open enrollment is now underway, but this year, millions of Americans shopping for health insurance on the Affordable Care Act marketplace are facing some of the biggest price jumps in years. Right now, the average ACA marketplace premiums are rising 26% nationwide, including 30% in the states using healthcare.gov. Enhanced federal tax credits expire at the end of the year. Without a renewal, those average payments could rise more than 100% in 2026. For people needing this coverage to start on January 1st, shoppers must enroll by December 15th. The open enrollment period runs through January 15th, 2026 on healthcare.gov. Let's dive a little bit deeper into this increase. We got Katherine Hempstead, the Senior Policy Officer for the Robert Wood Johnson Foundation. Welcome to the show.
Hi, thanks for having me.
Absolutely. How significant are the premium increases compared to previous ACA enrollment years?
Oh, I don't think there's a precedent. I mean, the gross premium, which you mentioned before, the kind of premium that the insurers are charging is increasing a lot, 26 to 30%, and that is, I think, probably larger than ever before, although there have been some double-digit increases in the earlier years of the ACA marketplace. But I think the really salient thing for consumers is that their net premium is going to go up much more than that. They're going to go up like 100% or more, as you mentioned, more for some enrollees because of the expiration of these enhanced premium tax credits. So that means that the tax credit that put a wedge between what the insurers were charging and what consumers have to pay, that wedge is getting smaller. So consumers are going to face a big increase in the price that they're expected to pay.
Wow. Kevin, how concerned are you that we could see that uptick in uninsured rates this next year?
Oh, I'm very concerned. I mean, nationally, the CBO has estimated that something around 4 million people will become uninsured just because of these changes in the Affordable Care Act marketplace. And, you know, I'm holding aside all the things that are happening in the Medicaid program and the other kinds of federal policy changes coming that, you know, en masse, people have anticipated something more like 11 to 15 million people to become uninsured over the next 10 years. But just focusing on the ACA impact, yeah, I think there's going to be a sizable impact on uninsurance because many people are going to look at the higher prices and they're going to decide that they can't afford their coverage and they're going to drop their coverage. And, you know, unfortunately, what happens when there's something like that is that healthier people are more likely to drop their coverage so that the people that stay in the marketplace are sick or use more services. And that's one of the reasons that the gross premiums have gone up, because insurers are sort of anticipating that, and that can kind of build on itself, and that market can then sort of become less healthy as time goes on if we continue to see those trends.
So what kind of practical advice would you give to customers who will see that sudden spike in their insurance premiums?
Well, certainly, you know, we say this every year, and it's sort of more true and less true. Shop around. I mean, things are bad. There are some really negative developments that are not good for consumers, but you still should look around. Some people are going to be tempted to buy down to a lower actuarial value, like say go from a silver plan to a bronze plan, because that's a lower premium. But it's really important for people to keep in mind that that's going to come with more required out-of-pocket spending as you actually need care. So you might pay less per month for your premium, but then you're going to find you have a much larger deductible, a much larger maximum out-of-pocket. Your copays are going to be bigger, fewer things you're going to even be able to make a copay for. So then you're going to be asked to shell out more money when you seek care. And if you have a low income below 250% of federal poverty level, which is, you know, like less than 40,000 for a single person, then if you go down to bronze, you're giving up this extra benefit called cost sharing reduction, which significantly lowers the amount of out-of-pocket spending you have to do, but you have to keep a silver plan to get those benefits. So, I mean, people have to do what they have to do. Some people are going to buy down to bronze because they just have to. And then, you know, what's unfortunate then is as people live their lives and have other bills and stuff, they may find, I'm not really able to go to the doctor or use my insurance because the out-of-pocket expenditure is so high. So I think that's, in addition to the people that drop coverage, we're going to see more people who are sort of underinsured. And what goes along with that is people not getting the care they need or going into debt. There's a cascade of bad things that can happen when people have no insurance or not enough insurance.
Got it. Katherine Hempstead, thanks so much for joining us. Thanks so much for your insight today.